A patient with dysphagia is at a high risk for which complication? A. Dehydration. B. Hypertension. C. Pressure ulcers. D. Osteoporosis. Answer A. Dysphagia, difficulty swallowing, increases the risk of dehydration due to inadequate fluid intake. Which of the following is the best way to prevent the spread of infection in a healthcare facility? A. Wearing gloves at all times. B. Using alcohol-based hand sanitizer only. C. Washing hands properly and frequently. D. Keeping patient doors closed. Answer C. Hand washing is the most effective way to prevent infections. A patient with chronic obstructive pulmonary disease, COPD, should be positioned in which way for easier breathing? A. Supine with legs elevated. B. Prone with head down. C. Fowler's position. D. Side lying with knees bent. Answer C. Fowler's position, sitting upright, helps improve lung expansion. If a patient begins to choke but can still speak, what should the CNA do? A. Perform abdominal thrusts immediately. B. Encourage them to cough forcefully. C. Give water to clear the throat. D. Call for emergency assistance immediately. Answer B. If a person can speak, coughing is the best way to clear the airway. When assisting a patient with hemiplegia, paralysis on one side, which side should you dress first? A. The strong side. B. The weak side. C. Both sides at the same time. D. The side closest to you. Answer B. Dressing the weak side first makes it easier to put on clothing. A patient with diabetes should have their feet checked regularly for what condition? A. Pressure ulcers. B. Dry skin. C. Ingrown toenails. D. Open sores or infections. Answer D. Diabetic patients are at high risk for foot infections due to poor circulation. A CNA should never do which of the following when providing catheter care? A. Clean the catheter tubing away from the body. B. Hold the catheter bag below bladder level. C. Tug or pull on the catheter. D. Wear gloves while handling the catheter. Answer C. Pulling on a catheter can cause serious injury or infection. A patient on fluid restriction should avoid consuming which of the following? A. Broth and soup. B. Mashed potatoes. C. Bread and pasta. D. Cheese and crackers. Answer A. Soups and broths contribute to fluid intake, which should be monitored. What is the first thing a CNA should do before transferring a patient from bed to a wheelchair? A. Secure the wheelchair brakes. B. Lift the patient using maximum force. C. Ask the patient if they can stand on their own. D. Place the wheelchair far from the bed. Answer A. Securing the brakes ensures safety and prevents falls. When measuring a patient's pulse, where should the CNA place their fingers? A. On the carotid artery in the neck. B. On the brachial artery in the arm. C. On the radial artery at the wrist. D. On the femoral artery in the thigh. Answer C. The radial pulse is commonly used for routine checks. A CNA walks into a patient's room and notices a fire. What is the first action they should take? A. Attempt to extinguish the fire. B. Pull the fire alarm. C. Rescue the patient from the area. D. Open the windows for ventilation. Answer C. The RACE protocol, rescue, alarm, contain, extinguish, prioritizes patient safety. What is a CNA's legal responsibility regarding suspected patient abuse? A. Ignore it unless there is proof. B. Report it immediately to the nurse or supervisor. C. Wait to see if it happens again. D. Confront the abuser directly. Answer B. CNAs are legally required to report suspected abuse immediately. A patient with Alzheimer's disease is trying to leave the facility. What is the best response? A. Block the exit and force them back. B. Ask why they want to leave and redirect them. C. Let them leave to calm down. D. Call security immediately. Answer B. Redirecting helps prevent agitation without confrontation. A contracture is best defined as A. A severe joint infection. B. A permanent shortening of muscles. C. A temporary loss of movement. D. A condition affecting only the fingers. Answer B. Contractures occur when muscles become permanently stiff due to inactivity. What is the primary goal of range of motion, ROM, exercises? A. To strengthen weak muscles. B. To prevent joint stiffness and immobility. C. To improve cardiovascular health. D. To increase weight loss. Answer B. ROM exercises help prevent contractures and improve mobility. If a patient has Clostridium difficile, C. diff, what type of precautions should be used? A. Airborne precautions. B. Standard precautions only. C. Contact precautions with gloves and gown. D. Droplet precautions. Answer C. C. Diff is spread through direct contact and requires special precautions. A CNA finds a patient on the floor after a fall. What should be done first? A. Help the patient stand immediately. B. Assess the patient for injuries and get help. C. Leave to find the nurse. D. Scold the patient for not calling for help. Answer B. Safety is the priority, so assessing injuries before moving the patient is critical. If a CNA hears a DNR, do not resuscitate, order for a patient, what does it mean? A. The patient cannot receive any medical treatment. B. The patient should be left alone during a crisis. C. The patient should not receive CPR if they stop breathing. D. The patient must be discharged. Answer C. A DNR means no CPR should be given in case of cardiac or respiratory arrest. Which of the following best describes a normal range for an adult's blood pressure? A. 90/60 mmHg. B. 120/80 mmHg. C. 160/100 mmHg. D. 80/40 mmHg. Answer B. 120/80 mmHg is considered a normal adult blood pressure reading. When feeding a patient, what is the most important thing to check? A. That they are eating all their food. B. That they are in an upright position. C. That they are using utensils properly. D. That they finish their drink first. Answer B. Sitting upright helps prevent choking and aspiration. A patient is feeling faint while standing. What should the CNA do? A. Hold the patient upright and encourage deep breaths. B. Lower them gently to the floor to prevent falling. C. Tell them to sit immediately. D. Call 911. Answer B. Lowering them prevents injury from an unexpected collapse. The first sign of a pressure ulcer is A. Open sores. B. Deep wounds. C. Redness that does not fade. D. Skin with blisters. Answer C. Persistent redness is an early sign of pressure ulcers. How often should a bedridden patient be repositioned? A. Every 30 minutes. B. Every 2 hours. C. Every 6 hours. D. Only when necessary. Answer B. Repositioning every 2 hours helps prevent pressure ulcers. A resident with Parkinson's disease has difficulty walking. What should the CNA do? A. Encourage them to walk quickly to avoid falls. B. Provide a walker or assistive device if needed. C. Hold them tightly by the arm while walking. D. Avoid assisting unless they ask for help. Answer B. Assistive devices help patients with Parkinson's maintain balance and mobility. A CNA is assisting a visually impaired patient with eating. What is the best way to describe the food placement? A. Name each food as you place it in their mouth. B. Use the clock method to describe food locations. C. Feed the patient without speaking. D. Arrange the food randomly on the plate. Answer B. The clock method, e.g., peas at 3 o'clock, helps visually impaired patients navigate their plate.